If you clicked on this, I'm going to guess it's not because you're curious about blood pressure, it's because you've been quietly scared of it, maybe for years, and nobody ever explained it in a way that feels calm, practical, and actually true. You've seen the numbers. You've heard the warnings. Maybe you've had a doctor say, "We need to watch this," and suddenly your own body feels like a ticking clock. But here's the reframe I want you to hold on to from the very first minute. Most of the fear around blood pressure comes from myths, simple-sounding ideas that spread fast, stick hard, and keep good people anxious, confused, and sometimes doing the wrong things. Today, I'm going to walk you through 8 of the most common blood pressure myths that keep patients scared, what the science actually says, and what you can do today to feel more in control. And I'll also give you one simple 2-minute reset that can lower your reading in real time for many people. Not as a cure, not as a replacement for treatment, but as a tool you can use when you need your body to stop acting like it's in an emergency. And at the end, I'm going to answer the question I hear constantly in clinic, but almost nobody says out loud: if my blood pressure is high, does that mean a stroke is around the corner? We'll handle that gently, clearly, and honestly, because you deserve clarity, not panic. I'm Dr. Helen Marlowe. I've worked with older adults for 15 years, and if there's one thing I've learned, it's this: you don't need more fear. You need better signals. Quick note before we begin: this is educational, not personal medical advice. If you've had chest pain, stroke symptoms, fainting, severe shortness of breath, or a blood pressure reading that's extremely high with symptoms that's urgent, seek care immediately. And if you're on blood pressure medication, blood thinners, or you have kidney disease, heart failure, or a history of serious heart rhythm problems, keep listening, but use anything I share as a discussion starter with your clinician, not a do-it-alone plan. Now, let's make this simple. Here's where we're going. First, I'll give you the real basic mechanism, why blood pressure rises and falls in the first place, without medical jargon. Then we'll break the biggest belief that fuels anxiety. Then you'll get the 2-minute tool. Then we'll go myth by myth, 8 of them, each with a clean takeaway you can actually use. Then I'll show you exactly how to apply this at home and in the real world, including one easy breakfast pattern and one restaurant strategy that lowers friction. Then we'll cover the 3 most common mistakes that sabotage people, even when they're trying hard. And finally, I'll tell you what to expect over time. What you might notice day 1, week 1, weeks 2 to 4, and by a few months, so you're not guessing or obsessing over every single reading. If you want more calm, science-based tools for staying independent, strong legs, steady balance, better sleep, healthier arteries, consider subscribing after you hear the plan, because I build this channel for people who want to live longer with their freedom intact. All right, let's break the core belief first, because it sits underneath almost every fear. The myth that blood pressure is basically one thing: salt, or one fate, genetics. That belief sounds logical, because salt is real, genes are real, and blood pressure is a number, so it feels like a simple equation. Less salt equals lower number, bad family history equals doom. But your body isn't a single-button machine. Blood pressure is a moving signal created by several systems negotiating with each other every second. Your blood vessels squeezing or relaxing, your kidneys deciding how much fluid and sodium to hold on to, your nervous system deciding whether you're in alarm mode or safe mode, and your heart adjusting output based on what your body thinks it needs. You can think of it like the water pressure in a house. The pipes matter, the pump matters, the control panel matters, and the filter matters. If you only obsess over one part, like how salty the water is, you miss the real levers that change pressure in the whole system. Here's the simple model. Blood pressure is largely driven by 2 big forces: how tight your blood vessels are and how much fluid is moving through them. Tight vessels plus more fluid equals higher pressure. Relaxed vessels plus less fluid equals lower pressure. And the tightness piece is heavily influenced by your nervous system, your vessel lining, inflammation, sleep quality, stress hormones, activity level, and even how stiff your arteries have become with age. This is why 2 people can eat the exact same meal and get different readings. It's also why you can have a high reading after a stressful phone call and a lower one after a quiet walk, even with the same salt intake. Now, I want to give you a mini payoff immediately. Before you judge your blood pressure, control the conditions. Sit, support your back, feet flat, arms supported at heart level. Quiet room if possible. Breathe. And take two readings, 1 minute apart. Most people never do this, and it changes everything. Which brings us to the 2-minute tool. This is the one I use in clinic when someone's nervous, their reading is high, and I can literally see their body bracing, like it's about to be punished by a number. The goal is not to force the number down. The goal is to tell your nervous system, we are safe, because that signal relaxes vessels and can lower the reading. Here's the simplest version. Inhale gently through your nose for about 4 seconds, then exhale slowly for about 6 to 8 seconds, like you're cooling a spoon of hot soup. Do that for 2 minutes. Longer exhale than inhale. If you feel dizzy, stop, especially if you've been breathing shallowly from anxiety. Why does this work? Slow breathing with a longer exhale tends to increase vagal tone and support the baroreflex, the reflex that helps your body regulate pressure beat to beat. It's not magic, it's physiology. And here's the practical payoff. Even if your long-term blood pressure is still a work in progress, this technique often reduces the white coat spike, whether the white coat is in a clinic or inside your own head at your kitchen table. Now keep that tool because it will come back later, especially when we talk about home monitoring and the myth that one reading equals reality. Myth number 1, I can feel my blood pressure, so I know when it's high. This myth terrifies people because it turns every headache, every flush, every moment of dizziness into a threat. The truth is, most high blood pressure has no symptoms at all, which is why it's called the silent condition. Headaches can happen for many reasons. Dehydration, poor sleep, tension, sinus issues, caffeine changes, and they are not a reliable blood pressure detector. Dizziness can come from inner ear problems, low blood sugar, dehydration, medication effects, or standing up too fast. Feeling your heart pound can be anxiety, caffeine, deconditioning, or an irregular rhythm, and it doesn't automatically mean your blood pressure is dangerously high. The actionable takeaway: stop using symptoms as your measurement device. Use a cuff correctly and use patterns over time. And if you're having severe symptoms, chest pain, severe shortness of breath, weakness on one side, trouble speaking, that's not blood pressure symptoms, that's emergency territory. Myth number 2. One high reading means I have hypertension and something terrible is about to happen. This is probably the most harmful myth because it creates a loop. You measure, you see a high number, you panic, the panic raises the number, then the number proves the panic. Blood pressure is a variable. It changes with posture, pain, stress, talking, a full bladder, recent activity, caffeine, nicotine, and even how tightly you're holding your jaw. Clinically, we diagnose and treat based on repeated readings, taken properly, over time, and in context. A single reading is a snapshot, not a verdict. The takeaway: when you see a high number, your first job is not to catastrophize. Your first job is to standardize. Sit quietly 5 minutes, do the 2-minute breathing reset, and recheck. If it's still high, write it down. If it's extremely high or you feel unwell, seek care. But for most people, the story is told by trends, not spikes. Myth number 3, home blood pressure monitors are unreliable, so there's no point. I understand why people believe this, because some cuffs are cheap, some are poorly sized, and measurement technique is often sloppy. But home monitoring, done correctly, is one of the best ways to understand your true baseline, because it reduces the stress response that happens in clinics. The science supports home readings as valuable, and many guidelines rely on them. The real issue is not that home monitoring is useless, it's that most people were never taught the basics. Here's your mini payoff. Cuff size matters. If the cuff is too small, your reading can be falsely high. Arm position matters, arms supported at heart level. Back support matters, feet flat matters. Talking matters, don't talk. And timing matters. Measure at consistent times, ideally morning and evening for a week when you're tracking. The takeaway: don't throw away the tool, learn the technique. Myth number 4, if my blood pressure is high, it's basically because I eat too much salt. Salt matters for many people, yes. But the bigger truth is that blood pressure responds to an entire pattern: sodium intake, potassium intake, fiber, alcohol, body weight, sleep quality, physical activity, insulin resistance, stress load, and medication effects. Here's a calming fact. In studies, the DASH eating pattern, rich in fruits, vegetables, legumes, whole grains, and low-fat dairy, with limited ultra-processed foods, lowers blood pressure even when sodium isn't extremely low. because it changes vessel function, potassium balance, and overall diet quality. Potassium is especially important because it helps the body excrete sodium and relaxes vessel tone. Foods like beans, lentils, leafy greens, yogurt, and certain fruits support this. Another reason this myth persists is because salt is an easy villain. But in real life, the biggest sodium sources for most people are not the salt shaker. It's packaged bread, soups, sauces, deli meats, fast food, and ultra-processed snacks. So the deeper lever is not never use salt again. The deeper lever is eat more foods that come from a kitchen, not a factory, and balance sodium with potassium-rich whole foods. Takeaway: if you focus only on salt, you might miss the bigger drivers that matter more for you, especially sleep apnea, alcohol, inactivity, and insulin resistance. Myth number 5. Blood pressure medication means I failed, and once you start, you're trapped forever. This one is loaded with shame, and it keeps people from getting treated when treatment can prevent strokes and heart failure. Medication is not a moral judgment. It's a tool. Some bodies need it because arteries stiffen with age, kidneys handle sodium differently, genetics influence vessel tone, and sometimes lifestyle changes alone are not enough, or not enough quickly. And here's another truth. Medication can be temporary for some people, especially when the main driver is weight gain, high alcohol intake, poor sleep, or a reversible medication side effect. For others, medication is long-term, and that's okay. The goal is not no pills. The goal is a brain that stays supplied with blood, kidneys that last, and a heart that doesn't have to push against high pressure for years. The takeaway: your plan can include lifestyle and medication without shame. And if you want to reduce medication burden, the path is not panic. It's steady, supervised improvements in sleep, weight, diet quality, and movement with your clinician monitoring. Myth number 6. Coffee is always dangerous for blood pressure, so I must quit completely. Caffeine can raise blood pressure temporarily, especially if you're sensitive or you don't use it regularly. But the effect varies widely. In habitual coffee drinkers, the spike is often smaller, and some studies suggest coffee can be neutral or even associated with certain health benefits in many people. The bigger issue is the context. What's in the coffee when you're drinking it and what your nervous system is doing. A sugary coffee drink with a large dose of caffeine taken when you're already stressed and underslept can absolutely push your numbers up. But a simple coffee in the morning paired with breakfast might be fine for many. Also, nicotine and decongestants are far more likely to elevate blood pressure in a meaningful way than moderate coffee for many seniors. The takeaway: don't fear a single beverage as if it's poison. Test your response. Take your blood pressure before coffee and 30-60 minutes after on a calm day. If it consistently spikes you, adjust. Smaller dose, earlier timing, or switch to decaf. Myth number 7. If I have high blood pressure, exercise is risky, so I should take it easy. This myth steals independence. Regular movement is one of the strongest lifestyle tools we have for lowering blood pressure over time, especially walking, gentle cycling, swimming, and strength training that matches your ability. Yes, blood pressure rises during exercise. That's normal because your body is pushing blood to working muscles. The long-term adaptation, however, is healthier vessel function, better insulin sensitivity, improved nitric oxide signaling in the vessel lining, and often a lower resting blood pressure. The real danger is not appropriate movement. The danger is being sedentary while your arteries stiffen and your legs weaken. For seniors, the most protective form of exercise is often the simplest. Brisk walking most days, plus 2 or 3 short strength sessions per week, focusing on legs, hips, and back. The takeaway: if you're unsure, start small and consistent. 10 minutes after meals, 1 lap around the block, sit to stands from a sturdy chair. And if you have chest pain, severe shortness of breath, or you've been told you have unstable heart disease, you need individualized guidance. But no movement is rarely the right answer. Myth number 8. High blood pressure means a stroke is imminent, so I should be afraid all the time. This is the loop I promised we'd close, and I want to do it with care. High blood pressure is a risk factor, not a countdown timer. Risk factors work like weather, not like a bomb. They change probability over time. A single reading doesn't predict tomorrow. What predicts outcomes is the average pressure over months and years, combined with other risks like smoking, diabetes, kidney disease, atrial fibrillation, cholesterol pattern, and age. Yes, extremely high blood pressure with symptoms can be dangerous and requires urgent care. But for the vast majority of people watching this, the fear that any high reading means a stroke is coming is not accurate, and that fear itself raises your readings and steals your sleep. The healthier frame is, my body is giving me a signal. I can respond with a plan. And that plan is built from controllable levers: consistent measurement, diet quality, movement, sleep, alcohol moderation, stress regulation, and medication when needed. The takeaway: replace constant fear with consistent action. Now, let's make all of this practical, because information without a routine just turns into more mental noise. Here's a simple action you can do today in under 10 minutes. Pick one daily measurement time, morning is easiest for most, and standardize it. Bathroom first, then sit 5 minutes, then do the 2-minute long exhale breathing, then take 2 readings 1 minute apart and write down the average. Do that for 7 days. That week of data is more useful than 50 random checks done in panic. Next, let's talk about food in a way that doesn't feel like punishment. If you want a breakfast pattern that supports lower blood pressure, you want 3 things: fiber, potassium-rich foods, and a protein source that doesn't come packaged with a lot of sodium. A simple example: plain yogurt with berries and a spoon of chia or ground flax, plus a handful of walnuts. And if you want something savory, add a side of tomatoes or sautéed spinach. Another option: oatmeal topped with berries, cinnamon, and a spoon of nut butter, plus a side of low-sodium cottage cheese or an egg if eggs work for you. The point isn't perfection, it's the pattern. Whole foods that support vessel function and keep your blood sugar steadier, because blood sugar swings and insulin resistance can stiffen vessels and push pressure higher over time. Now, the real-world example everyone needs: restaurants. The goal in a restaurant is not to eat like a monk. The goal is to avoid the sodium trap without feeling deprived. Here's the script. Ask for sauces and dressings on the side, choose grilled or baked proteins, request vegetables without heavy seasoning, or ask for lemon and olive oil. And if soup is your only option, know it's usually a sodium bomb. So balance it by splitting it and pairing with a salad, or choose a different starter. If the menu is mostly ultra-processed, your escape hatch is simple. Pick the least processed item, avoid adding salty extras, drink water, and take a 10-minute walk afterward. That post-meal walk is not about burning calories. It's about improving vessel response, helping glucose handling, and reducing the pressure load your system feels after a heavy meal. Now, before we move to what results to expect, I want to call out 3 mistakes that keep patients stuck, because these are unbelievably common, and fixing them often lowers readings faster than any fancy supplement. Mistake 1: measuring in the middle of stress and treating the number like a verdict. If you measure right after an argument, after watching the news, after rushing, after climbing stairs, or while you're talking, you're not measuring your baseline. You're measuring your nervous system. Fix: standardize your measurement as I described and use the 2-minute breathing reset before checking. Mistake 2: using the wrong cuff size or placing the cuff incorrectly. Too small equals falsely high, and placing it over clothing or too low on the arm can distort readings. Fix: bare arm, correct size, cuff aligned as instructed, arm supported at heart level. Mistake 3: making changes too extreme, too fast, and then quitting. People will go no salt ever, no carbs ever, exercise every day for an hour, and it collapses within a week, and then they feel defeated. Fix: pick one lever that is low friction and high return, like a 10-minute walk after 1 meal per day, or replacing one ultra-processed snack with nuts and fruit, or doing the breathing reset daily, and build consistency before intensity. Now let's talk timeline, because this is where anxiety often lives. On day 1, the most common change you notice is not the number, it's the feeling of control. When you measure properly and you stop spiraling, your body often calms. Some people notice better sleep that night because the fear loop quiets. In week 1, if you start walking after meals or reduce ultra-processed sodium sources, you may notice less swelling in your hands or ankles, less morning puffiness, and more stable energy. Weeks 2 to 4 is where many people start seeing a clearer trend in readings, especially if alcohol intake drops, sleep improves, and daily movement becomes routine. By months 2 to 3, the improvements compound: better vessel function, better weight trajectory, better glucose handling, and often fewer scary spikes. Now, one honest note: sometimes what gets worse first is cravings and restlessness, especially if you've been relying on salty snacks, sugary drinks, or late-night screen stress. Your body can protest when you remove what it used as coping. That doesn't mean the plan is wrong. It means you're retraining your signals. And this is where the 2-minute breathing tool is not just a measurement trick. It's a coping tool. Use it when you feel the urge to chase the number. Use it when you feel the urge to doom scroll. Use it when your body feels loud, because you are teaching your nervous system a new default. Calm, not alarm. Let me bring this home with a simple reassurance. You are not broken. Blood pressure is not a personality test. It is your body responding to inputs. Sleep, food, movement, stress, stiffness, fluid balance, and those inputs can change. To recap in 5 clean lines, stop believing you can feel your blood pressure. One reading is not a diagnosis. Salt is only one piece of the puzzle. Medication is a tool, not a failure. And fear is not a treatment plan. Your real mechanism is vessel tightness plus fluid, guided by kidneys and nerves. Your most powerful daily lever is consistency. Measure correctly, use the 2-minute long exhale reset, move a little every day, and shift toward whole foods that bring potassium and fiber into the picture. Your simple protocol is standardized morning checks for 1 week, 1 blood pressure-friendly breakfast pattern, 1 restaurant script, and a short walk after meals. And the mistake to avoid is turning the number into a threat, because the threat response raises the number. If you want to tell me one thing, keep it simple. Which myth has been scaring you the most? Was it the "I can feel it," the "one reading means disaster," or the "I'm trapped on meds" story? And if this helped you feel calmer and more in control, consider subscribing, because on this channel, we focus on the practical steps that keep you steady, strong, and independent. Your body isn't your enemy, it's your instrument, and you can learn to play it gently, starting today.